I'm Greg Williams, and I'm jumping in for David Smith for a special read on the tea leaves for September 17th, 2024. If you are like me, and you or a loved one has ever struggled with a mental health or addiction issue, last week was a big moment. The Biden administration dropped its final rule on mental health parity, and it's poised to send shockwaves throughout the healthcare system for payers, providers, and patients. This final rule is the first meaningful update in over a decade in the enforcement of a 2008 bipartisan law signed by President George W. Bush, the Mental Health Parity and Addiction Equity Act. This law lays out the promise that mental health and substance use services, both in-network and out-of-network, would be covered on par with any physical health or surgical benefit offered. And the new final rule released last week lays the groundwork for developing data-driven plans to demonstrate and insurers developing their mental health provider networks with the same access and coverage that is found in their physical health networks. This is huge since today, the 156 million Americans with commercial insurance are 1,000 times more likely to go out of network for mental health or substance use services than they are for physical health services. Given the current mental health and addiction crises across the country, this discrepancy in coverage and access of care leads to lower utilization of life-saving behavioral health services. Because what that means is to walk into a therapy appointment or a residential treatment provider, more often than not, patients are faced with coming up with $5, $7, and sometimes $10,000 in out-of-pocket costs before their insurance kicks in at all. Now, from where we sit in the business of healthcare, providing a robust in-network continuum for mental health and substance use services is good for everyone, including the payers. Even Cigna proved to themselves recently through their own data that driving up utilization of mental health care services saves money by reducing total cost of care for individuals. While many advocates see an opportunity with this new rule to improve access and coverage of mental health care, others see it as a compliance nightmare. It's a level of scrutiny that the insurance industry hasn't faced before, and we expect significant pushback. The insurance industry has already released statements suggesting that the rule's requirements are overly burdensome and could lead to increased plan administration costs. So will this rule become the catalyst that propels us towards a truly equitable system between mental health and physical health? Time will tell. But one thing is clear, whether or not the new rule gets bogged down in legal challenges and implementation hurdles, employers who drive the majority of the commercial insurance market want their employees and dependents to have access to high-quality in-network care for mental health and substance use disorders. And since the customer is always right, whether it is because of this new federal rule or not, we expect a brighter future where coverage and access to mental health care is dramatically increased in the coming months and years. We'll see you next week for another read on the tea leaves.